Hello everyone, and thank you for joining us today on our webinar on Myths and Facts, Suicide Prevention in the Workplace. My name is Laura Mullally, I am a program manager with our workplace team here at the Mental Health Commission of Canada. I'm very happy to be hosting the webinar with you today and to be able to introduce our presenters from the Centre for Suicide Prevention. Before we hand the presentation over to them, I'd like to quickly talk about a couple of housekeeping items about using our software today. Audio is provided in broadcast mode only, so through your computer speakers. So you can hear us, but we cannot hear you. So if you have any questions or comments throughout the presentation, we invite you to please write them into the Q&A chat box on the bottom right of your screen. We will hold most of the questions until the end of the presentation. This webinar is also being recorded. The recording and the presentation slides will be posted on our webinar archive section within the coming few weeks following the webinar. Please note at the end of the presentation there is a resources slide with links to most of the documents referenced throughout the presentation today. You can download a PDF of those slides right now by selecting the document on the top right and clicking Download Files. Note that this presentation will be conducted in English. However, the slides will be available in both English and French, along with the recording on our website, again, in the next few weeks. I'm very pleased to introduce our two speakers today. Hilary Sermon is the Director of Impact and Engagement at the Centre for Suicide Prevention in Calgary, Alberta, an education branch of the Canadian Mental Health Association. She holds a Bachelor in Education and a Master's of Public Administration degrees from Queen's University, as well as certificates from Queen Smith School of Business and Marketing and Human Resources. Hilary has worked at the Centre since 2013 and has over 10 years experience in training, talent management and consulting in a variety of nonprofit and private sector organizations in both Canada and Australia. Robert Olson is our second speaker, and he's a librarian and writer at the Centre for Suicide Prevention in Calgary, Alberta also, which is, again, an education branch of the Canadian Mental Health Association. He holds a Master of Library and Information Science degree and a Bachelor of Arts in English Literature degree. He has worked at the Centre since 2011. We are very pleased to have both Hilary and Robert join us today to talk about this valuable topic. With that, I will pass it over to Hilary and Robert to get this presentation started. Hilary?
Great. Thank you very much, Laura. Welcome, everyone. Thank you to you for joining us. My name is Hilary Sermon. On behalf of my colleague Robert Olson and I, we're delighted to have you tune in. We'd like to offer our thanks to Laura, Hannah, Ashley, and all of the team, the Mental Health Commission of Canada, for hosting today's webinar and helping us with the technology. The Centre for Suicide Prevention was established in 1981 to provide suicide prevention education to all Canadians. And specifically, in the last 3 years, we've been expanding this mission to include education on suicide prevention for workplaces. This morning's presentation is a version of a session that we offer to workplaces and organizations to begin breaking down the stigma and talking about how we respond to coworkers who may be in suicidal crisis. This presentation was also delivered at the May 2017 CMHA Alberta Provincial Conference in Red Deer to coincide with the release of our Workplace and Suicide Prevention Toolkit, which is a free resource available on our website. I reflected this morning on the way into work and got almost a bit nostalgic about where we started and where we've come in talking about suicide in the places where we work. And we started at the Centre going into companies to talk about suicide prevention in the context of occupational health and safety. And we were met with responses such as asking if we could not say the word suicide when talking about this issue. And now, here we are providing a webinar for hundreds of working professionals who join us today out of your own interests and your needs for more information. This is significant and meaningful to us. We've noted, particularly in the last 8 months, that the interest and demand for suicide prevention information in the workplace has skyrocketed. It's now the norm for us to go into organizations and hear personal stories from colleagues in front of their coworkers, speaking openly and bravely. We're honored that you'd share this interest in learning more about suicide prevention and how we can begin this important dialogue in the workplace. Over the course of the webinar, we hope to help to respond to some of the common questions or concerns that we frequently come across when we go into companies to talk about suicide prevention. And on this slide, you may be thinking some of the things that we often encounter. Does the state of the economy, a recession or a downturn, affect the rate of suicide? In your colleague level, are you concerned about someone you work with? What are the signs? What should you say? Or yourself, are you feeling stressed out or at your limit at work and not sure that you can take much more? Our agenda this morning starts with some myths and facts about suicide, so a 101. Robert will then move us into the workplace and suicide, so we'll look specifically at the content from our latest toolkit on those warning signs, the stats and facts, and what do we do if we tragically experience a coworker's suicide. And we'll conclude with some information about us as an education branch of the Canadian Mental Health Association, the training and resources that we provide. So what do we know about suicide? Well, suicide is complex. We all come from different places of experience and understanding of this mental health issue. When we speak within organizations, we do recognize there will be employees there who are on command performance. So either, fortunately, have no previous experience, or perhaps even may be totally uncomfortable with the topic. Others may attend out of a personal or professional interest about mental health and suicide prevention, and that's a wonderful platform to launch from. But increasingly, we find that people in the room have lived experience, and they've been directly affected by a suicide of a coworker, a family member, or a friend. So to acknowledge and honor the variety of experiences, values, and beliefs about suicide when we present at organizations, we like to start with a 101, the facts and myths of suicide as a baseline or common ground. So to do this, we have some statements about suicide that we are going to try and make as interactive as possibly can. So we have a few poll the audience questions that we're going to put out to you. So this is your chance to interact online with us. So we're going to ask you the first statement. So more men die by suicide than women. And if you can input whether you think this is a myth or a fact, and then Laura will help us reveal the results. Great. Okay, let's go. So this statement is actually a fact. So men die by suicide more than any other group. Well, we know that women attempt suicide more. Men die by suicide 3 times more often than women in Canada. So we have some stats here from 2013 and from Health Canada at the bottom of the slide for First Nations youth. And we can see those rates in comparison to Canadian averages for First Nations male youth. We also know for First Nations female youth, their rates are 35 per 100,000 compared to 5 per 100,000 for non-Indigenous female youth. Okay. Our next statement. Teenagers are the most common age group to die by suicide. Is this a myth or a fact? This is actually a myth, and it's maybe surprising to some people. Males aged 40 to 65 have the highest numbers of suicides. So why are we losing so many men to suicide in Canada? Well, men are expected to be tough, financially stable, stoic, and therefore they're less likely to seek help before reaching a crisis state. The stresses of work, societal expectations and pressures placed on men, the tendencies for males not to seek out help, and the choice of lethal means of suicide, such as firearms, are among the chief explanations. Men can be at risk of suicide if they abuse drugs or alcohol, are socially isolated, have experienced trauma previously, or have a diagnosed mental illness. Our next statement, and we have an interactive poll question here. The suicide rate is higher during the holidays. Please input whether you think this is a myth or a fact. We'll give you a couple minutes to do that. Great, okay, let's move ahead. It's actually a myth to think that the suicide rate is higher during the holiday period. What we know is the suicide rate is actually fairly consistent throughout the year. So there wouldn't be any day, time, event, or holiday where people might be more vulnerable to suicide than any other time in the year. And if anything, the holidays can often be a protective factor for those at risk. Our next statement. Depression is present in at least 50% of all suicides. Do we think this is a myth or a fact? It's actually a fact. So the management of depression is a very important component of occupational health. Depression is a major contributor to reduced work performance, absenteeism, and potentially suicide. We know those suffering from a diagnosed depression are 25 times greater risk for suicide than those not. A third of adults with a diagnosed depression receive the treatment that they need for their condition. When we look at young people and teens, those who receive treatment is even less than all other age groups. And we have estimates that only a fifth of our young people afflicted are getting the help that they need. Our next statement. If we take a worldview, globally, more people die by suicide than in war and homicide combined. Is this a myth or a fact? Every year around the world, we lose almost 1 million lives to suicide, according to the World Health Organization. If we're looking at the numbers affected strictly by suicide versus those in war and homicide combined, these numbers as a global health issue can be staggering. We have another poll question here, I believe. Asking someone if they're suicidal may put the idea in their mind. Who thinks this is a myth or a fact? Great. Okay, thanks for your input. It's a myth, and in fact, a most critical myth to understand when we talk about suicide prevention. Asking someone directly if they're thinking of suicide and if they have a plan can reduce the likelihood that they attempt. It relieves the burden that they're carrying. Asking someone does not put the idea in their mind. If there's anything that you can take away from today's webinar, it would be this key understanding to suicide prevention. So that 101 is provided just to give some basic examples of facts and myths and conceptions and examining our values and beliefs about suicide. So we move now to look at what the suicide landscape and rates are across Canada. Our statistics page on our website gets a significant amount of traffic where we compile stats from across the country. This provides a snapshot of raw data of the provincial and territorial rates per 100,000 from 2014 to 2016 in Canada. And you can see that we have grouped the territories together at the top, followed by the provinces. The raw data that we've just shown in that previous slide, we now reflect in a series of line graphs. And what we'd like to do here is provide the comparison to all of Canada to the provinces and territories. So in this slide, we can see results of the Western Canadian provinces to the rest of Canada. So if you can see the slide where the indigo or navy blue line is Canada, and then we see the provinces themselves, so BC in red, Alberta in the lighter blue, Saskatchewan in purple, Manitoba in the lighter blue, and how they compare to the national Canadian average. If we look now to central Canada, again, we can see the Canadian national average in the blue, Quebec on top in the green, and Ontario below in the red. There are comparisons here in the Maritime provinces. Canada in blue, Newfoundland in red, PEI, green, New Brunswick in purple, and Nova Scotia in the lighter blue. So again, if we look at Canada as the comparator line, we can see who is above, and in some cases well above, the Canadian national rates, and those who are below. And finally, we'll look at the line graph for the territories. So most, I think, stark in this graph is we can see the very blue line at the bottom is the Canadian average. And we see where Nunavut, where the Northwest Territories, and the Yukon compare. So quite stark, quite sobering results here. I'd now like to pass it over to Robert, who will work through some of the content from specifics around the workplace and suicide.
Thank you very much, Hillary, and hello, everyone. So I'd like to ask the question, why is it important to know about suicide within a workplace? Well, work is a major part of most of our lives. Many of us spend up to 60% of our waking hours at work. When a work colleague dies by suicide, the emotional and financial costs can be enormous, not only for family members, but for coworkers and for the organization itself. Workplaces need to have preventative measures in place to inform and educate their employees about suicide. Here are some warning signs coworkers experiencing suicidality may have. If they appear suddenly happy after a period of depression, this could indicate a calm resolve to carry out a suicidal plan. If they're acting out aggressively or appearing more stressed than usual. If they're mentioning being tired all the time, showing visible signs of fatigue. If they're commenting on being a burden to others, saying things like, "I'm sure everybody would be better off if I wasn't around." If they're missing a lot of work, either intermittently or being absent for long periods of time, so absenteeism. Or if they're being less productive while they're at work, being unmotivated or just not into it, so presenteeism. And these signs, which require immediate action, if you notice a coworker exhibiting, include talking about wanting to die or killing oneself, looking for a way to kill oneself, or admitting to having a suicide plan. Now I'd like to throw out some facts and figures about mental health, suicide, and the workplace. A Mental Health Commission of Canada study in 2013 reported that there was a loss of $6 billion in annual productivity due to poor mental health. A respected study from 2009 suggests that for every 1% increase in the unemployment rate, there is a corresponding 0.79% increase in the suicide rate. A 2015 Alberta report estimated that the direct and indirect costs of suicide in Alberta would exceed $811 million for that year. A recent figure emerged from the United States estimating the cost of one suicide to be $1.7 million. And an often repeated Canadian figure from 1996 estimated a suicide to cost $850,000. Unfortunately, we don't have any more recent Canadian estimates. And finally, 70% of all suicide deaths in Canada are among working-aged adults, those who are between the ages of 30 and 64. And 75% of those are men. So what are some preventative measures workplaces can adopt? Well, there should be positive promotion of mental health within the organization, things like paid mental health days, ample vacation time, and benefits that acknowledge both physical and mental health services. There should be availability of employee assistance programs in human resource departments to help employees access mental health services. And ideally, there should be suicide prevention training, either knowledge-based programs like Safe Talk or more in-depth skills-based programs like Assist. And a workplace should try to foster a culture where help-seeking is supported and looked at as a positive thing and nothing to be ashamed of. So if you think a coworker may be suicidal or harboring suicidal ideas, how do you talk to them? Well, you could say something like, "Hey, I've noticed you aren't acting like you usually do, and I'm concerned about you." And if you're really concerned, ask them directly, are you thinking about suicide? Do you have a plan? At worst, they will say, "No, of course not," but they will understand that you care. And as Hillary said earlier, this will definitely not put the idea in their head. It'll give them an opportunity to talk. And try to connect them with resources within your organization or in your community. You can be a bridge, a liaison to get them the help they need. So just what does an organization organization do, though, if they do experience the suicide of an employee? Well, an appropriate swift response is crucial. This is called postvention, which is an essential and critical part of prevention. Immediate steps that should be taken are leadership must send condolences to the family and ask if they are comfortable with their acknowledging the death as a suicide to others in the organization. While respecting the family's wishes, communicate news of the death to colleagues and employees in the organization. And follow any existing crisis response internal policies. In the days and weeks following, leadership should identify those employees most impacted by the death and ensure grief supports are available for them. And to offer resources and supports to all employees. And to decide on whether or not to memorialize the deceased. And if so, do so in appropriate ways. For example, do not mention the method of their death and try to emphasize positive aspects of the deceased's life. And in the months and years following, leadership should ensure that preventative measures like those mentioned on the previous slide are put into place.
Thanks, Robert. Over the past 3 years that we've worked more with businesses and organizations, there's a number of learnings that we've come to bear. The first is that dealing with mental health crises or suicide prevention in the workplace is not just HR's problem. It just can't be pigeonholed to one department or one group of employees. The other learnings are employees are open to the information, and everyone in your organizations will know someone somehow affected by suicide. Stigma and survivor guilt. So when we talk about survivors, those who are grieving the loss of someone to suicide, or even in the economic context of those who have perhaps survived a layoff, that may prevent employees from reaching out for help. It's important in our business places to discuss this openly and create that culture where we're valuing emotional and mental health and safety just as much as physical. Preventing a suicide is really something that anyone can do. It does not take a business expert. We can all learn the simple skills to help save a life. The Center for Suicide Prevention, we work with corporate and public sector clients to educate and train employees and the teams on these simple steps for awareness and prevention. Our mission is to educate for life, and as I mentioned, we've been around since 1981 to increase awareness and reduce the stigma surrounding suicide through education. And we're fortunate that education is a best practice in suicide prevention. There are not many best practices, but there are 4. So early detection and screening of mental health and depression, reduced access to lethal means, responsible guidelines for media reporting of suicide, and fortunately, education and awareness are these best practices. How can you help? What can you do within your organizations at your frontline level? Well, of course, you can begin by educating yourself like you're doing today. You can take a workshop. And again, this idea of creating the culture that if we build that safety net within our organizations, our communities, and our neighborhoods, where we value people's mental and psychological safety as much as their physical shell. The workshops that we provide through the Center for Suicide Prevention provide the following skills. So we talk about how do we identify the signs of someone who might be at risk? How do we more actively listen? How do we discuss suicide directly and ask people if they have a plan? And then how can we connect people to help? This idea of connection is very important. People often feel, broaching the idea of suicide, that you have to solve the problem, that you have to be the doctor or the clinician. And in many cases, it's just not possible. We cannot solve the problem for someone in crisis. They have to do it themselves. But what we can be is that connector to help. And we can work with that in person to help them identify, is it someone within HR? Is it someone within the employee family assistance programs you have in your organizations? Is it a family member, a doctor? Who could be that person that can provide that next level of care and support? There are 2 workplace workshops that we highly recommend when we go and talk to organizations who want to do more in the space of training for their employees. So within Alberta, our center provides Safe Talk, which is suicide alertness for everyone. This is a great workshop for workplaces. It's half days, approximately 3 to 4 hours, talks about the signs, and again, this idea of how do we identify and get help for that person at risk. Assist, which some of you may be familiar with, is the Applied Suicide Intervention Skills-Based Training. And this is really the suicide first aid. It's a 2-day skills-based workshop for intervening with people at risk. So in addition to these 2 workshops, our center also offers, through our network of trainers, workshops across Canada. We have 2 workshops pertaining to those who care and support for youth and teens, if that's of interest to you, as a parent or family, first responders, anyone working with children and youth. The first workshop is called Straight Talk, Preventing Suicide in Youth, and the second is called Tattered Teddies, Preventing Suicide in Children. We also have a series of workshops in an Indigenous stream, so a workshop called Little Cub, which is Preventing Suicide in Indigenous Children. Walk With Me, which is a session on the impact of suicidal grief on individuals and Indigenous communities. And then we also offer River of Life, which is the Indigenous Youth Suicide Prevention online course. If you're interested in information about any of these trainings, it's available on our website. In addition to the workshops, we provide free resources for everyone to learn about suicide prevention in Canada. Our web resources are available for free for anyone to download, print, and share. And I've given you our website on this slide, and then just a small example of the over 45,000 documents and resources we have available 24/7. These are the links to some of the more prominent content that we've delivered in today's webinar. So the Workplace and Suicide Prevention Toolkit itself, which we encourage everyone to go and get a copy of. Our suicide statistics, so if you're interested in looking more in depth at those charts and raw data figures, you can access it there. And then further information on those workplace workshops that I'd mentioned, the Safe Talk and Assist. That concludes our formal presentation part of the webinar before we move into the questions. We'd just like to thank all of you again for joining us. And if we can say that suicide prevention is everyone's business in any business. We welcome your input, your comments, and your questions. Thank you so much.
Thank you very much, Hillary and Robert, for that great presentation, presenting some of those key facts and figures, as well as some resources that I think everyone can find beneficial, both personally and in the workplace. So we have had some questions coming in, which is excellent, and we'd like to open up kind of a question and answer period. And just a reminder to everyone to please pose your questions using the Q&A pod on the bottom right-hand corner of your screen. We'll try to get through as many questions as possible in about the next kind of 20-25 minutes that remains. So please pose your questions. We are receiving them, and then we'll pose them aloud to Hillary and Robert. So there's been a few questions, as I mentioned, coming through. Firstly, earlier in the presentation, you mentioned 4 ways to prevent suicide. Can you kind of repeat those again and then kind of expand on those a little bit more?
Sure, Laura. We're just reviewing our notes to see where
Yeah.
So are you referring to the 4 best practices?
I believe so. Yeah, the question was the 4 ways, but I believe it's those 4 best practices you had mentioned earlier.
Those were created by the World Health Organization, I believe, in 2001-ish, and those are the 4. Those are the 4 practices they believe that all suicide prevention efforts should contain. So, and one of those that is pertaining to today in particular is education in suicide prevention and awareness. But others include best media practices. I'm just trying to remember off the top of my head. There's 2 more. Best media practices and
early depression screening.
Early depression screening and
reduced access to lethal means.
And reduced access to lethal means. Thanks, Hillary. Yeah. So.
Perfect. Thanks so much. And in terms of, you mentioned kind of media guidelines and how media should report on on a suicide. Can you discuss that a bit more in terms of what that means and those kind of reporting best practices?
Well, sure. Yeah, I mean, I think the most significant point for the media is not to glorify or romanticize a suicide, for one. Another specific recommendation is not to include the word suicide in a headline. But there is an encouragement to reporting on suicide, where for many years the media believed they should not report on it at fear of sparking contagion. So that was an impetus for these guidelines to come out in addition. But I think that the major one is not to sensationalize it. And a good example of the way media reportage and its effects pertaining to suicide have occurred. If you compare Marilyn Monroe in the early 60s and the way her death was covered versus Kurt Cobain in 1994, there was a contagion effect in 1962, I believe. That was Marilyn Monroe's death, and because of not appropriate coverage of the death and perhaps sensationalism. And in 1994, there was a more concerted, measured approach to reporting his death, including disclaimers and including messages to get help if you are experiencing suicidality. So it was an early positive reaction to a celebrity death and reporting of it. So I just thought I'd highlight that comparison. Does that answer your question?
Yeah, definitely, and thanks for using that example. Another question is just kind of thinking about the diverse workplace environments we have now, kind of in the 21st century, including people working remotely, working from home, companies, organizations that may be spread across multiple countries and all kind of electronically kind of communicating with each other. Is there any unique considerations that these types of non-traditional work environments should consider, and how does kind of the workplace toolkit that you've released apply to those types of environments?
Well, that's a good question. I mean, more and more workers are, as you say, in environments that are, I guess, non-traditional. I guess the key would be for having those services and resources available to that someone in a more traditional role receives, available to those in the non-traditional role. I guess the key point would be how would that look and how are they delivered, and just try to, I think, override or replace this kind of isolation or maybe lack of interaction with colleagues with some sorts of replacements, I guess. That's a challenge, I think, going forward, for sure. Hillary?
When we've gone into organizations, particularly in the industries of oil and gas, for example, or coal, I mean, those workforces are often, working at isolated sites. They're not always together, for example, those kinds of industries. And really where we see them putting some more emphasis is just making sure the communication lines are open to their employee family assistance programs. It's surprising oftentimes many of the employee groups don't even know that they have a hotline or crisis lines available to them through their employer. So it's just important to keep that information current, phone lines, emails, and websites accessible to employees who, whether through remote distance working or isolated work sites, sort of always feel that they have that line of contact available to them.
Perfect. Yeah, I think that we're moving more and more towards those different types of work environments, and not everyone's physically in the same space seeing each other day to day. So that's great considerations to have. What about considering different sectors? So there's been some questions about some particularly challenging sectors, ones that have been mentioned, such as first responders, healthcare workplaces, for those who are working in mental health and addiction services themselves. How is suicide prevention different in kind of as we look across different sectors and specifically in sectors which may be kind of more challenging in terms of the workers' psychological health and safety?
Well, an important study came out last year from the Center for Disease Control and Prevention, I guess it's called now, in the United States, in looking at, and it's in the toolkit, and it's looking at the, let me find it here, suicide in the U.S. Workplaces from 2003 to 2010, and they found that the industries where people were most at risk for suicide were in the farming, fishing, and forestry areas, 3Fs, I guess, but very high rates of suicide, and followed by construction and installation, maintenance, and repair was the third. Now, they also, some at-risk factors are if someone in their occupation has easier access to lethal means. So, for example, a first responder in the sense of a police, or even paramedics in relation to prescription drugs, they have access to more lethal means than others. So that is a huge factor. Exposure to chemicals. So many farmers are exposed to pesticides, so they have access to use that, although it's a less common one in North America than in the rest of the world. But it is used as a means of suicide sometimes. But also exposure over time it's been shown to cause mood or behavior impairments, exposure to chemicals. If your occupation has a high level of stress, so trauma, dangerous working conditions. If there is job insecurity, so if it's a tenuous position, if it's contract, if you're always fearing that you might not last more than the upcoming months. If you have a low wage in comparison to the general population. Stressors related to gender imbalance. So the highest occupations for females are those positions of women who work in traditional male roles. So and that would include the police and other first responders. And I'm citing that from the same report from the CDC. And if there's an inconsistent work schedule, so shift work, and a disruption of family routine, inconsistent sleep patterns, etc. And the last point, which is especially appropriate for those three that I mentioned at the beginning of farming, fishing, and forestry, and that's isolation in the workplace. If someone is lacking interaction with their colleagues and with others, there is a higher risk for suicidality in the context of the workplace. I hope that answers your question. Maybe it was more than you wanted.
That's perfect. I'm sure the details are very appreciated. Kind of switching gears a little bit, and do you have any research or resources or just thoughts in general on peer support groups in the workplace and how those might be helpful in terms of suicide prevention?
Well, I know CMHA has programs that might fit that description. Perhaps those who are interested could email us and we can look into that. I don't think we have an answer for you at the ready, though, unfortunately.
Peer support.
That's okay. Sorry, go ahead.
Yeah, I was going to say it's very interesting, and it seems to be drawing upon my comments from the beginning of the presentation of, where we've seen the stigma breaking down in more and more workplaces, from literally going into organizations asking us to not say the word suicide, to now, people are presenting or opening up the presentations in front of their colleagues with their own stories of lived experience. And I think this idea of peer support or colleague support is happening more and more organically. The more and more that we break down the stigma and build that awareness, those supports seem to be sort of coming together. I mean, slowly. We have more work to do in this space, and workplaces are challenging places to show your vulnerability at times. But I think that the groundswell movement for mental health and support, and then with that, suicide prevention is starting to happen. So those conversations and sort of supportive leaders or peoples within the organization may be happening organically, or there may be things that organizations can do to more formalize that.
Perfect. Thank you very much for sharing that. There's a few questions in terms of some of the education and courses that you have mentioned, such as Safe Talk and Assist. How frequently would you suggest people take the Assist training? And then just kind of as a secondary, are any of your courses or learning programs available online, or are they all in-person training?
Sure. The Assist program, I'll start with that question, Laura. Assist is sort of a 5-year cycle. When you take your first Assist, you get a certificate, as you do with all of our workshop programs. And that initial certificate is valid for a period of 3 years currently. So at the 3-year mark, then you will take what we call a tune-up workshop. So it's your upgrader, it's your refresher, that then will continue your certification in Assist for another 2 years. So within it's that 5-year cycle. So the first workshop is valid for 3 years. You take a refresher, it gets you valid for another 2 years. And then the idea being if there's updates to the material or curriculum or advances in the field, then you'll review that at that 5-year mark. With Safe Talk, it's a certificate valid for life. So once you take the Safe Talk program, you do have that certificate valid for perpetuity. Most of our workshops that we deliver, and again, we have a trainer network across Canada of over 150 trainers on contract to us delivering our programs. I would say the majority of them are face-to-face, with the exception of River of Life, which is the Indigenous Youth Prevention Program, which is currently online.
Perfect. Thank you very much. There were a few questions in terms of some of the facts and figures that you mentioned earlier on in the presentation. Specifically, on slide 27, you mentioned that there's a U.S. study that estimated the cost of one suicide costing $1.7 million. So just wondering what's kind of taken into consideration when calculating that type of cost? And just, if you could expand a bit more on that figure.
Well, it's looking at, if I understand your question, so it's taking into consideration the cost of, like the direct costs of say the first responders, the physicians, the hospital if necessary. So the autopsy, if one is needed, a funeral, the cost of a funeral, and then the more indirect costs, and these are the bulk of the cost of a suicide, and that would be the productivity losses that society bears over time. So the discounted future earnings the deceased person would earn, but won't because they have taken their own life. So that's the majority of the costs that I believe are factored into this into that figure. If people, it should be cited in the toolkit, the actual study, so people can look at the document themselves, and it'll break down more what I was just referring to.
Thank you for clarifying that. I just want to mention that we are having many questions come through the chat pod, so we're trying to get to as many as we can in the time that we have remaining. Also, a few my coworkers who are in the room with me, some people are sharing some resources or different kind of thoughts that to share to the group, so they are kind of sharing those so everyone can benefit from some of that information. So just wanted to mention that. There was another question about kind of in terms of some of those rates that we discussed earlier. Do we understand why the suicide rate is higher in the territories versus other provinces? If you can talk a bit about kind of the distribution in Canada.
Well, the territory of Nunavut, which has the highest rate of any territory and, of course, any province, has a high percentage of the Inuit as their population, and they have the highest rates of suicide throughout Canada and many of their communities, and that includes outside of Nunavut in Northwest Territories and in parts of Labrador and northern Quebec. Because they are the majority of the population in that territory, that explains the extremely high rate that Nunavut, the territory, has. Now, Northwest Territories also has a high rate, as does Yukon. These two territories also include mainstream populations, higher numbers of those, as well as First Nations, and also a lower rate of suicide among the Inuit. So it does explain its high rate, but also not quite as high as Nunavut. But to get into the specifics of why, will take an entire webinar itself, and I would not do the Indigenous people justice by trying to explain it in a couple of sound bites. So I'd invite people to go to our website. There are documents that we've created that address that very issue, though. So.
Thank you very much for kind of clarifying that a bit and sharing some of those statistics. There's some questions coming in about supports that workplaces should put in place following the suicide of a coworker or someone in the workplace. And there's a specific example that's given in terms of a few years have passed since the suicide of a work colleague. Nothing was done at the time, but how could current leadership address this situation, as some of the staff are new and weren't around at that time, but other staff are still in place? So just kind of generally, could you speak about how the workplace could put in supports following the suicide of a coworker, and then just in general, the ongoing support kind of currently and also moving into the future?
Well, I'll try and take a stab at that answer, and maybe Hillary can follow. I think, depending on the organization, I think before any decision to say commemorate a deceased former employee's death is made, a decision to do that, you make sure, and this was mentioned during the webinar, just that grief supports are in place for those who may be vulnerable, might react in a distressed way to the news that you're acknowledging and commemorating the suicidal death of a former coworker, former employee, and that's crucial to have that addressed at the outset. And then as far as commemorating it, we don't think there's anything wrong with that in particular, just as long as it's not glamorized, the method of death or anything like that. I think it's important, though, to acknowledge the contributions of a former employees who may have contributed to the company and done so in an appropriate way. So I guess, do you have any ideas?
Some of the companies in contacts that we've worked with also try to take advantage of the opportunities, for example, on a World Suicide Prevention Day, for example, or a Mental Health Awareness Week, just to, without perhaps getting to all of the details, but recognizing that that own company and that own organization has also been impacted on a personal level by these issues as well. So when you're taking advantage of sort of the commemorative days that exist already and to raise awareness and build supports, you can acknowledge that on an organizational and individual level as well, that you have not been immune to this and you are also impacted, and that's why you're moving forward to raise awareness and provide resources. And I think what Robert said as well, though, just ensuring that the grief supports, the employee family programs are communicated and are available to all colleagues. So those who perhaps knew a colleague who's lost or not, is just so important going forward.
Thank you very much. There's a question, and I guess just kind of more broadly, and we all kind of, I'm sure most of us have heard of the recent release on Netflix of that 13 Reasons Why program about a year or so ago. Just some thoughts you might have on how that relates to suicide prevention, and has that changed the conversation both more broadly but also in the workplace? How did that kind of video affect your work, and have you seen any kind of repercussions from it?
Well, it's interesting. We knew beforehand it was going to be released, and we knew the content of it because the book's been out for a good decade or so. So we anticipated when Netflix was the upcoming release of it that there might be some furor and controversy, and we prepared resources, including a school-based toolkit to actually deliver that novel in a novel study. So that's one way we dealt with it. But also we reached out to the publishing company. Hillary can maybe speak about that in a second. To try and meet any kind of negative response that the series might generate. And initially there was nothing, but then there was a groundswell of reaction, and the reaction that we anticipated at the beginning came fast and furious, and if we, in an ideal world, that movie would not have come out, but we've tried to do our best to promote safe messaging about suicide in response to it. And the particular example, though, I'll let Hillary talk about, is our reaching out to the publishing company of the book prior to the Netflix release. If you want to talk about that, Hillary.
Sure. Our primary concern or focus with the 13 Reasons was getting information to the youth themselves about what to do if they are in crisis or if they have a friend who is in crisis. So what is that actual line of support they can reach out to? So I give great commendation to Random Penguin House Canada when we approached them about inserting, I believe, some bookmarks, was what we ultimately landed on in terms of people purchasing the book that had a number. I believe it's the Kids Help phone number included on that, just as a reminder to the kids, if things are triggered or they're questioning things, or different things are happening either from watching the Netflix series or reading the book, that there is a line of support available to them. So that was our primary focus in getting that prevention and support message out.
Thanks very much. Yes, very topical kind of time. I know we had conversations about it here at the Commission also, about kind of what this means and kind of the response, both largely in the media and also kind of our response also. I think we only probably have time for about one more question before we do a quick wrap-up, as we only have a few minutes left here. Maybe just as a closing question, how do you see kind of workplace suicide prevention initiatives, and how does that align with kind of a broader kind of psychological health and safety strategy that a workplace might implement? How can supervisors support their employees broadly in terms of psychological health and safety, and then how does that kind of fit in with your recommended best practices for suicide prevention?
That's an excellent question to close with. Really, I think for organizations, it's to start to identify some of the key mental health issues or challenges that you want to start to address. And you can build on this in layers. I mean, it can be daunting, it can be complex, it can be overwhelming to look at the whole field of mental health or mental illness and say, you know, where can we start, what can we do? But I think it's important just to take it in small steps. So whether that's starting with information sessions, so, you know, when we go into organizations, for example, and do the myths and facts, and that's just information. And we can build upon that then with some training or resources or, you know, health fairs. All those sorts of things in the whole guise of providing information, but also breaking down stigma is really important. And I think if we look at baby steps in organizations, so what are the small steps that we can take? What are the small bites of information that we can get across? You know, and where do we want to focus? You know, do we want to start with depression, for example, as a means to being that stop in that pipeline to suicidal crisis? So looking at ways we can support employees with information in that regard. It's just really important in the whole context of education, awareness, and stigma. And again, making sure employees are aware of what their employee family assistance program plan provides to them, who are the numbers that they can call, and what are the emails and website resources, because there's just a tremendous amount of information out there, but it's just it's prioritizing it, it's synthesizing that information, and then moving forward as a company just to say, you know, this is important to us, we want to provide this information, and here's some resources available to you.
Thanks very much. Yeah, I think that's a great kind of overall summary of a lot of the work that you presented here today. As you mentioned, there is a wealth of information out there. I'm glad we were able to share some of that information and some of those resources with the people here today on the line. I hope that you found it beneficial. I'd really like to thank both Hillary and Robert for their presentation. I thought it was extremely valuable. I just want to remind everyone that on the top right-hand corner of their page, they can download the slide deck right now in PDF format, as well as there's a direct link to the toolkit, the workplace toolkit they were referencing, if you want either of those resources. This webinar was recorded. We'll be posting both that PDF as well as the recording of this webinar on our website. So if there's any of your colleagues who weren't able to attend in the next few weeks, that will be posted on our website. I just want to also note that shortly in the next kind of few hours, you'll receive a thank you email that contains a satisfaction survey. We ask that you kindly take a few moments. It's only about 5 or 6 short questions to let us know how you felt about this webinar. It helps us to continue to improve our webinar series, as well as gives you an opportunity to recommend potential topics for future webinars. Also, just to note that we'll be taking a break from our workplace webinars in December, so please join us again for our next webinar in January. And with that, we just want to close. Again, thank you so much to our speakers, to my 2 colleagues in the room who've been helping me out, both Hannah and Ashley, as well as to all of you for joining us today and taking time out of your day to learn about this important topic. We hope you have a great day, and we'll see you back on this workplace webinar series in January. Thank you so much.